Former Seventh Heaven star Stephen Collins is under investigation. The celebrity news website TMZ reportedly obtained an audio recording of Collins' confession to molesting and exposing himself to at least 3 underage girls. Collins, who portrayed the Reverend Eric Camden in the TV series, is in the middle of a divorce. On the recording, he apparently confesses to the crime during a therapy session that his wife secretly recorded. And in health news, new evidence suggests everyone over the age of 45 should be tested for prediabetes and type 2 diabetes. Rise News medical contributor Dr. Aletha Maybank has more on that story and other stories. Hey, Aletha, it's good to see you.
Good evening.
So is this because we're all getting, fatter and, eating more junk food, and so this is the new normal?
Absolutely. So this is a reflection of recognizing that we have an obesity epidemic, which is a significant risk factor for diabetes. So the United States Preventive Services Task Force, which is a governmental body that really provides a lot of recommendations on what we should be doing and how we should be doing to prevent disease, has really come out with this recommendation that anybody 45 and older, no matter what your background or your history, should be tested for diabetes, or for you should have your glucose checked. Prior to that was really for people who are at higher risk for heart disease. But because of this epidemic that we all hear about, and a lot of evidence is now coming forward to show that if we can identify those folks who have pre-diabetes, and by that I mean those who, if you have a fasting glucose test, your sugar level, your glucose level is between 100 and 126. If we can identify those, get them into a healthy lifestyle treatment type of program with exercise and good eating habits, we can decrease the risk of actually getting diabetes by 47%.
Wow, so you can really just beat back the disease, if you will.
Absolutely, and prevent it, because it's really pre-diabetes. Diabetes, the diagnosis is greater than 126, and you really can just prevent the diagnosis. So that's really what this is really targeted at. So if we can identify more folks earlier, then the better. And so now they're actually pushing back the recommendation all the way to 18. And those folks, if you're 18 or older and you have risk, we are recommending for glucose testing.
And what would those risks be?
So risks such as a family history of diabetes, heart disease, risk of obesity, and we know obesity is a significant risk factor for diabetes as well.
Mm-hmm. I wonder, is there something magic about the age 45?
Not particularly magic about age 45, but it's an age at which we know that start to get that risk for diabetes.
Got it. Very important.
And we start to see diabetes show up.
Okay. All right. Let's move on to the next one. Tobacco is tied to higher risk of the oral human papillomavirus (HPV).
Right. So this was a national study, the national NHANES study that the CDC does almost every single year. And what it noticed is that those who were tobacco users, predominantly smokers, they had higher biomarkers within their blood and urine, also had a higher incidence of having human papillomavirus. We've heard a lot about human papillomavirus from the vaccine that people know that young people potentially can get and help prevent the disease, but we know it's a significant risk factor for getting cancers, vaginal cancers, or cervical cancers rather, as well as oral cancers. And so HPV 16 is the one that is what they're really noticing is at an elevated level in tobacco smokers. They're not quite clear why, but what they're thinking is that the tobacco is actually preventing the disease from clearing, because sometimes these viruses actually clear themselves and they go away, but the tobacco may be making the body more susceptible to holding on to the virus.
And is there a difference between those who smoke the tobacco as opposed to those who use other tobacco products?
Yeah, they were noticing mostly those who are smoking tobaccos, as in cigarettes.
It's very, very, very interesting. And so let's talk about this HPV 16. What are, first of all, the dangers of it?
Well, the dangers of it is, one, the primary one is that it actually can cause and increase your risk for cancer. And so what they're noticing, for throat cancers, the primary risk back in the days was really tobacco as well as alcohol. But tobacco use has really decreased across the country. We are starting to see some elevations. But what's coming forward is that human papillomavirus is now becoming the forerunner of what is causing throat cancers.
And I heard you say they don't really know what this connection is, but
between the tobacco and the HPV, but it's very clear as far as the HPV's connection to causing cancer.
Yeah, absolutely. Absolutely. I was going back to the connection between the tobacco use and the HPV. And is there any indication that this connection is more likely biologic or physiologic or behavioral?
Great question, and I think that's still to figure out, because right now we're not quite clear on that, but there needs to be more studies to kind of look deeper into what is this connection, because we're definitely not saying it's a cause and effect. if you smoke, you're going to get human papillomavirus. That's not what we're saying, but there definitely is an association. If it's biological or if it's behavioral, we're not quite clear completely on that.
Before we move on to our third and final topic, just give a quick blurb about the importance of the HPV vaccine as it relates to young girls.
Absolutely. I mean, if we can prevent human papillomavirus in children, we can prevent them of getting HPV and cancer as they get older, and cervical cancers, especially in females, and oral cancers in males. So the recommendation is at 11 to 12 years old, they can get the vaccine up to age 26, actually. So we really, really would like for parents and for children and for young adults to get the vaccine if they have not received the vaccine.
Okay, let's move on to this final topic. These are all important, but this one particularly for women, and that is being able to detect ovarian cancer in vaginal fluid.
Right, so ovarian cancer, this was a pilot study, a very small study, 8 women, and they looked at vaginal samples and they were able to look and find DNA and finding samples of cancer and DNA cells from cancer, my apologies. And so they were able to find them in the fluid. Why this is important is, one, this is a new test that came out. They were not able to find these DNA bits before, so this is very new. 2, why it's important is that ovarian cancer is very difficult to screen for. We actually have no screening tests for ovarian cancer. And usually when women are diagnosed, it's very late in the stage. If women are diagnosed early, they actually can be treated and they can recover pretty well. But most women are not diagnosed early, 44% death rate within 5 years. And so if we can have a screening test that identifies actually DNA from this cancer in the vaginal fluid, it potentially offers an opportunity to find and develop a screening test. But more evidence, more data, more tests definitely need to be done in order to really hone in on what needs to be done to find the screening test. And we have to make sure it finds the positives and make sure it doesn't create risk and false positives when we don't want to have too much scare.
Indeed, very important indeed. We have to continue to monitor that. We'll leave it right there for now. Aletha Maybank, thank you so much.
Thank you.
See you next week.
Thanks.